First, my name is Denise Garlick. I'm a state representative from the 13th Norfolk. I am both a nurse and a legislator. I want to share with you as a nurse that I have worked in ICUs over the course of a career that began in 1975. I was an ICU nurse in both medical and surgical ICUs in the VA system. I worked in a non-union community hospital special care unit. I worked in a non-union ICU in a rural hospital, and I spent many, many years in an ICU in an acute care hospital in Boston. In addition to that, as a legislator, I just wanted to share with you, when you look at the actual legislation that was passed on this ICU regulation, in the space for the Speaker of the House, I was given the privilege to sign this bill. It's the Senate President's name, the Governor's name, and my name. When I tell you that I know what's in this bill, I know what's in this bill, and I stake my own name and my own career on it. HPC is being asked to deal with the biggest issue of all, quality of care. This is the issue that this ICU regulation is about, that you're being asked to deal with. And this decision, the fourth stakeholder in this, of course, is the patient. And I want to tell you that without drama, I am telling you that an ICU nurse is the difference between life and death for a patient. An ICU patient is so vulnerable, is so fragile, circumstances can change so quickly that the presence of the nurse is what makes a difference. It is, in fact, the reason the patient is in the intensive care unit. Those very words, intensive care. As we look at the proposed regulation, I want to thank you for your work, and I want to specifically cite the fact that this directive, that this law, and the limits that it sets in place, this work, you have tried so very hard to make sure that that is so clear that you are following the directive of the law. But there are four issues for which I am concerned. The first is around, which I believe, sometimes with the very best of intentions, we get an outcome that we didn't intend. This law was about one-to-one nursing care for a patient in the intensive care unit. Any reasonable person knows that there might be some instance when it could be 1 to 2. The patient is ready to move out of the intensive care unit. You know, for that brief period of time while you're waiting for the bed on the floor, you know, that patient may be more stable. I think the HPC, in its desire to be clear, became somewhat ambiguous because the repetition of 1-to-1 and 1-to-2 in the law makes it sound like, in your regulation, I'm sorry, in your proposed regulation, makes it sound like these are equal events. It was never intended to be an equal event. The law was written for 1-to-1 nursing care with respect to the fact in rare instances, it might be 1-to-2. I want you to know this proposed regulation, your hard work, and I know we tossed you the hardest ball of all. I know we did as a legislature because, quite frankly, we couldn't figure it out. But it was a very tough choice for the nurses and for the hospital administrators who agreed to this legislation. It was clear in that language what we were agreeing to. We were agreeing to 1-to-1 nursing care in the intensive care unit. And that legislation was passed unanimously in the House of Representatives. Any deviation from that intent of the law would be a travesty here, and I ask you not to do that. Although I know how careful and reasoned you are trying to be, I ask you to return to that language, return to that intent that is so clear, and ensure for the patients of the Commonwealth, from the smallest, tiniest, most vulnerable patients who now can weigh less than a pound, I'm sure you know, in a neonatal intensive care unit. When I began my nursing career, we didn't think babies less than 5 pounds could survive. Today, babies less than a pound are in the neonatal intensive care unit, and they do survive, and they do well if they have good enough nursing care. And across the age continuum, from people who suffer trauma to the people with the most grave illness, the most severe surgeries, the presence of the nurse, that 1-to-1 nurse in an intensive care unit, makes the difference for life and death. Thank you.
Thank you.